Thank you very much, Carolyn, and I want to thank the sponsors really for inviting me to come here today. I already have learned a great deal, and I am convinced that on the ground, the foundation has been laid here in the HSC system to do the monumental work of eliminating hospital-acquired infections. It is very clear that you share the values. It is very clear that most of you are actually convinced that this is doable. The question is now the commitment to do it. And I describe this phase of the journey as moving from being able to espouse the values to being able to practice them every day. And that's the really hard work of patient safety. And in that work, let me also say, we are all members of labor, whatever our rank. This is the work of labor. And without that, patient safety will never be advanced. So I'm going to share with you from the perspective of a leader how one engages workers by working with them, not telling them what to do, but working with them in the pursuit of patient safety. And I'm going to begin with a little bit of a vignette. It's not a movie because I'm very challenged from an IT perspective. So I just thought I would begin by characterizing for you what I think, by example here, is similar to the current state of American healthcare. So this is the actual transcript of a radio communication between a U.S. naval ship and Canadian authorities off the coast of Newfoundland that occurred in 1995 and was eventually released by Naval Operations. So the dialogue begins with the Canadians radioing the U.S. Ship, "Please divert your course 15 degrees to the south to avoid a collision." The United States ship radios back, "Recommend you divert your course 15 degrees to the north to avoid a collision." Canadians, "That's negative. We insist you divert your course 15 degrees to the south to avoid collision." Pretty clear what they want them to do. "This is the captain of the U.S. Navy ship. I say again, you divert your course." Canadians, "No, I say again, you divert your course." Now the escalation. "This is the aircraft carrier USS Lincoln, the second largest ship in the United States Atlantic Fleet. We are accompanied by 3 destroyers, 3 cruisers, and numerous support vessels. I demand you change your course 15 degrees to the north. I say that's 15 degrees north, or countermeasures will be undertaken to ensure the safety of the trip of this ship." The Canadians respond, "This is a lighthouse. It's your call." So much of this, I think, reflects the hierarchy and the miscommunication that lead to near misses every day on the floors of your institutions. But more importantly, I think it illustrates by analogy the fact that the U.S. healthcare system is on a collision course. And the vital work that HHC does is at risk because somehow we can't figure out how to bring value to our patients despite a $2.5 trillion commitment to healthcare. We don't lack the resources. We lack the proper stewardship of those resources. And I'm going to share with you this economic imperative as we go. So here's some facts related to what we heard earlier this morning, that in America today we spend 18% of every dollar earned on healthcare. The Centers for Medicare and Medicaid Services account for 20% of the total government expenditure of the United States of America. That's 8 times more than we spend on education, 12 times more than we spend on food aid, 30 times more than we spend on law enforcement, 78 times more than we spend on the conservation of the environment, 87 times more than we spend on having a safe water supply, and 180 times more than we spend on energy conservation. What that says is, when we make choices to spend more in healthcare, we are robbing our society of these other critical values. We talk about education, but we in healthcare are really the cause of why we can't advance the level of elementary and high school education in this nation, because we are consuming those vital resources. And the question is, are we good stewards of those resources? Now, you heard earlier from Dr. Grengrich, that 100,000 people die each year from these infections that they don't come to the hospital with. By comparison, about 48,000 people die in car accidents every year. 19,500 people are killed needlessly in homicides. There have been 5,588 Americans killed in the Afghan and Iraq campaigns. And all of this is estimated, all the error in healthcare, not just hospital-acquired infections, is estimated to cost the nation $400 billion a year. Said differently, we could have paid for healthcare reform, almost 50% of it, if we were committed to eliminating the waste that is illustrated by hospital-acquired infections, as an example. Now, by contrast, where I've learned and had my epiphany in this is by looking at how other highly reliable organizations become great. So looking outside of healthcare at American and European manufacturing corporations, for example, and asking how did they learn to make a perfect roll of aluminum? Or how did they learn to make a great automobile? And people often say to me, Dr. Shannon, we take care of leukemics, we don't make Camrys. But the reality is, understanding how process leads to outcome and how standard work can lead to perfect products and how learning is essential to both is the essence of how we can become better performers. So in the United States today, about 5 to 10% of everybody that enters a US hospital gets an infection. As you heard, we have about 2 million hospital-acquired infections each year. Somewhere between 90 and 100,000 people die of these things needlessly. And I want to point out that it's actually 27 times safer to work at Alcoa Aluminum, 324 plants in 27 countries where they make hot molten metal with 3-ton cranes moving overhead at 50 miles an hour around an assembly floor. It is 27 times safer to work in that environment than it is to walk into a US hospital. And Alcoa is the safest place in the world to work today because their leader, Paul O'Neill, said, "None of my workers deserve to be hurt." And our mission is not to become a Fortune 100 company. Our mission is to have the safest, most engaged workforce in the industry. And if we do that, we will be a Fortune 100 company. Finances are a derivative of work. They are not the work itself. And the amount of time we spend looking at financial sheets as opposed to looking at the work we do to produce those financial results is really a discordant issue in healthcare. So the message I'm going to leave you today is that when you look at data, it's got to be reportable. It's not only got to be reportable, it's got to be actionable. That safety is not about policies and procedures. It's not about those JCHO binders. It's about processes. Thirdly, you can come surprisingly close to eliminating most infections by standardizing work as opposed to just adding resources. Hospital-acquired infections are costing hospitals and society millions of dollars, which is the true illustration and problem of conspiracy between error and waste. And then I remind you of the admonition we heard from the very beginning this morning. As healthcare providers, first, we must do no harm. We are not given license to hurt people in a vigilant attempt to make them well. That is not what we have been sworn to do.